All right, I'm back with another video. Today I'm going to talk about prolonged labor. So there's many different causes of prolonged labor, and some of them, which often can lead to transport, include possible cephalopelvic disproportion, so a disproportionate size between the mother's pelvis and the baby's head, malpresentation, asynclitism, which is when the head's kind of cocked to one side or the other, a posterior labor when the baby's what we call sunny side up, uterine atony, which I'm going to talk about later, incoordinate uterine contractions, which I'm also going to mention, maternal exhaustion, maternal hypoglycemia, cervical dystocia, cervical adhesions, psychological factors, a tight or short nuchal cord, or a compound presentation or a nuchal arm. And I'm not going to mention all of these just for the sake of time, but I did want to talk about 4 P's of prolonged labor. So the passenger, the passage, the powers, and the psyche. And so within the context of these 4 things, I'm going to talk about how we might intercede for a mother who is experiencing a prolonged labor. So one of the first things I want to talk about is repositioning. And so this refers to assisting both the passage and the passenger. Depending on the position and presentation of the baby, there are numerous positions that you can try and use to give the baby a better passage through the pelvis, sometimes allowing them to turn or reposition to be able to navigate whatever was preventing them from coming through the pelvis or preventing the labor from progressing. And so I won't get into all of them here because there's a whole bunch that you can try for various different presentations. But there are positions and maneuvers that you can try for an asynclitism, for a posterior baby, for a brow presentation, for a face presentation. I think there's also a mentum presentation where the mouth is like the mouth and chin is the first part to emerge of the baby. And for those who might not know, the typical presentation is the back of the head. The crown of the head is coming first. So anytime that's not the case, it can cause the labor to be prolonged. So sometimes repositioning helps the baby to move, and sometimes that helps the pelvis to adjust and the tissues to move in a different way that can allow everything to open up, and the passage becomes more easily navigated by the baby. So that kind of concept of repositioning can refer to both the passenger and the passage, points 1 and 2. And then the third part is the powers. And so this refers to primarily the contractions of the labor. And so sometimes women will experience what's called uterine atony, which is when the labor will slow or even stop. And if a malpresentation or a posterior presentation is ruled out and the baby seems fine, often the best course of action is to allow the uterus to relax and to rest. And if we excessively stimulate contractions when against the uterus's natural inclination to rest, we can create constriction rings, which is when the uterus the muscle constricts at a particular part, which can prevent the baby from coming through because it's just so tight in that one area. It can also cause fetal distress and complications in the 3rd stage of labor to do with the birth of the placenta and that type of thing. And another thing that's similarly related is uncoordinated uterine action, which is when the 2 segments of the uterus, so the upper uterine segment and the lower uterine segment, as well as the cervix, contract in an incoordinated way so that they're not harmoniously working to bring the baby down and to open up and efface and dilate. And this incoordinated action is often marked by frequent, painful, but irregular contractions. And this can be exhausting and frustrating for the mother, as I'm sure you can imagine. And once a malpresentation and a posterior presentation as well are ruled out, we might consider that the polarity of the uterus is not optimal and that in this case she also needs to rest. And sometimes when you return to the labor, when contractions will resume again, they'll be in a better pattern and they'll be more effective. And then this point is sort of related to powers in the sense that maternal exhaustion is very much related to why a labor might be prolonged, and the labor can be prolonged because of maternal exhaustion, but also you can get exhausted because it's so long. So that's definitely something to be very aware of if you're with a mother who's experiencing a prolonged labor. And maternal exhaustion is the primary reason for hospital transport in a planned home birth. And maternal hypoglycemia, so low blood sugar, is the main cause of maternal exhaustion in labor. So Valerie L. Halta, one of the women that we studied in this program, she talks about giving salt in labor and sugar after. That's just her recommendation of what has worked best. But she also puts the caveat that if a laboring woman is asking for something, we give it to her. And so for salt, you might think of things like broth, miso soup, that type of thing that's light, easily digestible. Also includes liquids, which will help keep her hydrated. And then for sugar, you might think of like juice, honey sticks, light carbs, that kind of thing. And electrolyte replacement is also generally helpful for women in a prolonged labor situation. And then the fourth one, the psyche, is also can be a large factor in a prolonged labor. And I think many women can benefit from having someone who you can fully discuss all your fears and concerns of labor with before you get to the point of being in the labor process. And I think many women, have found or experienced, whether they see it subconsciously or subconsciously, is that emotions of various different types, as well as previous or ongoing abuse, maybe past experiences, past trauma, even fears like wanting a family member to be able to make it in time for the birth, can have a significant effect on her psyche and on the pattern of labor, as well as the ambiance of the room that you're in. That can have a big impact on our psyche, as well as who's present, what the environment is like. Is it cold? Is it harsh? Is it relaxing? Is it warm? Is it inviting? Is it comfortable? All those types of things can have a really big impact on our psyche and therefore on the labor that we experience. And I think those kind of main things that I mentioned in relation to the passenger, the passage, the powers, and the psyche, I think those are all really important, but also relatively easy things to do when you're supporting a woman who's having a prolonged labor. And there's so much more that could be said about this topic, obviously, and so I just have mentioned a few things here. But yeah, thanks for watching, as always, and I'll see you next time.